Hello, if the meeting has started, we're not hearing it on our end.
Can you hear now?
Technical interruption.
Okay.
Perfect, thank you.
All right, well, I didn't get far into it, so I'll try. Whereas aging and older adults are leaders, mentors, volunteers, and vital members of communities across our state who deserve to be treated with respect and live with dignity. And whereas established by the International Network for the Prevention of Elder Abuse and the World Health Organization in 2006, World Elder Abuse Awareness Day aims to promote a better understanding of the abuse and neglect of older adults. 2021 marks the 15th anniversary of its observance. And whereas last year, more than 10,400 reports of abuse, neglect, and financial exploitation of Wisconsinites aged 60 and older were received by the Wisconsin Department of Health Services Adult Protective Services Office. And whereas ageism and social isolation are major causes of elder abuse in Wisconsin and across the United States, and whereas preventing the abuse of older adults through maintaining and improving social supports like senior centers, in-home services, and transportation will allow older adults to continue to live as independently as possible and contribute to the life and vibrancy of our communities. And whereas today, the state of Wisconsin joins dedicated individuals and organizations in our state, throughout our country, and around the world in raising awareness, taking action to prevent and address elder abuse, and encouraging all people to recognize and celebrate older adults and their ongoing contributions to the success of our communities. Now, therefore, I, Tony Evers, Governor of the state of Wisconsin, do hereby proclaim June 15th, 2021 as World Elder Abuse Awareness Day throughout the state of Wisconsin, and I commend this observance to all our state's residents. Very nice recognition and very important and worthy goal.
Mr. Administrator, do you suppose that we should have a motion to accept this day in Polk County as have it in our minutes that we accept this day as a recognition of that? I would like to see that in our minutes.
I'd like to get that in minutes too. I think we can go ahead and do that. It's not on the agenda, but I think in this matter, it's.
Yeah, we can do that without the agenda. Would one of you like to support Sharon or somebody? Would you like to move to support this?
Sure.
I will. Dr. Log, a second by Sharon, to accept this Elder Abuse Day and recognize that through Polk County. Any discussion? All in favor? Aye. Contrary, motion carried. I think that's nice to have in our minutes. Would you imagine that of the 10,400 that most of that would be between residents? You know, one elder person against another. I can't imagine that there'd be that many staff. I think that would also include a resident abuse against a resident to make that work.
And you correct me if I'm wrong, but it doesn't necessarily have to be someone in a nursing home.
Exactly.
It could be anyone in the community.
Oh,
So, emotional abuse, financial abuse, there's any number of things. Actually, the display that we have outside of the front of the building today, it'll be there all week this week, but those are, for each of the signs, that's the 34 investigations that we did in 2020 through our Adult Protective Services Unit. And so each little emoji represents an investigation and the type of investigation that it was.
so am I?
There's a lot of financial abuse of the elderly by,
Generally the root of it, isn't it?
yeah, a lot of it is financial, by people requesting money. We actually had a family occurrence where my wife's uncle um, was, was, had a pastor change my wife from being the power attorney to him. And, I mean, it took a couple of years for us to resolve all these conflicts, you know. Subpoena medical records and prove that he was not competent to make that change. And so for a while, there were two powers of attorney, and you can't believe what a mess that was.
Well, what is it, a year or two ago, we had this statistic right here in Polk County that's the most mind-boggling statistic that I've ever heard in my life.
So I'm happy to hear that the Polk County is investigating these situations to
Well, that's a good discussion to find out what constitutes that number of statistic.
Mr. Chairman, if I could interject one thing, one of our homicides last year was a direct result of elder abuse. And it was so egregious that it was ended up being ruled, and I believe individuals brought to court,
Yeah.
you know, for charges over that. It was.
I remember that.
And the court didn't dismiss the charge, but they produced such a light sentence that it caused a lot of protest and controversy. Am I correct?
You know, I never actually even heard the outcome of the, of course, we were never called to testify.
I saw the outcome, and I think it was a 30-day, up with a 30-day court deal, and there was protest over
I think so. I
type
remember
of
that.
thing. Okay, anything else, Vince, while you're on, do you have anything else you wanted to address on the agenda as long as you're on the?
Well, next up on the agenda, Mr. Chair, is just an announcement that I am appointing Jerry Waller to the Veteran Service Commission Committee. And we'll be presenting this tonight in front of the Board of Supervisors who will give the approval, but I wanted this committee to know it. Got Andy Butzler, our Veterans Director here. Let me just tell you, Jerry Waller is very excited to be on this committee. 20-year veteran, including a leadership for non-commissioned officers program that he did at Fort Snelling in Minneapolis. He's been an executive in a couple of different corporations, and very excited to give back to the veteran community here in Polk County. He lives down in the Osceola area.
I don't even know. And, Mr. Service Officer, would you have any comments of anything to our committee?
I just feel he'll be a great fit, you know. I do know him personally outside of my role as the director. He's also my neighbor, so I've gotten to know him over the years, and I think he'll be a great fit. You know, he wants to do whatever he can as far as serving the veteran population and community.
Thanks for doing the research and coming up with a very good candidate. Yeah. Yeah, so we don't need to take action as a committee. That's, okay, moving on, number 8, Tanya, or our boss lady there.
Yeah, I'm here for the COVID update. So briefly, I'm gonna just go through some numbers. Last month in May, we closed with 255 positive cases of COVID. So far in the first 2 weeks-ish of June, we've only had 25 positive cases. So just forecasting ahead, I'm still waiting for if we're gonna have a spike for Memorial Day. We should see it shortly. I'm anticipating a spike after the 4th of July festivities, and then in the fall when students go back to school, I foresee another spike of COVID cases.
So on the first 15 days, half a month, we're down to 25.
Yes, but schools are ending, they're no longer in session. So now we just have to wait for the mass groupings that come together over the summer to see if we have any more.
Summer school and the activities really start up.
Yep. So, and then with that, we have our mobile clinic that we have been doing throughout Polk and Burnett counties. So far, we've done 18 of those days. With that, we have vaccinated a total of 484 individuals. So that's really, really great. We still are doing our on-site testing Monday and Wednesdays. We started that May 3rd. Total so far, we've done 151 tests. 27 of those tests were positive. And we also have our walk-in clinics on Tuesdays where we are now offering Johnson & Johnson and Moderna. And that's been about 30 people who have walked in to get vaccinated. The overall percent positivity has fallen. In May, we were at 7.3%. Now we're down to 3.6% positivity. The state is at 1.6. Our overall vaccination percentage has increased from 36% to 40%, and the state is sitting at 44% of the population that is vaccinated. So that's pretty much the overall COVID update. It's slowing down, but if we're seeing when groups are together over the summer, we're going to have more cases.
You think with these lower statistics now that we can get a better rating from the state?
Oh, our overall county rating, so it has gone up, but we're at like a low percent positivity for cases. We're not in a very high case load anymore.
Oh, that's what we wanted to hear.
Yeah, so we definitely have decreased since
We've had
May. Yeah.
a high case risk for a long time that we aren't happy about.
Yeah. So right now we only have 25 positive. So
Awesome.
any questions? Yeah.
But just for clarification, the numbers of those vaccinated here just include the Wisconsin residents, not the Minnesota residents?
Correct. So we only know who is technically living in Polk County.
But we have vaccinated a lot of Minnesota residents too. I'm not saying that's good or bad.
Yes.
It's good.
That's good.
Yeah, it's good. But it's nice to know, you already answered this question at the picnic, I think. But it's just nice to know that we are keeping track of those percentages and numbers are for Wisconsin residents, Polk County residents.
Well, that was a good question, Sharon, and we felt that a lot of our staffs were people that are working in Minnesota, came here and brought things in, and even some of our fatalities were like that.
And then the other thing I do want to mention as part of our health equity grant, we have been working with our migrant population in the community, and our mobile task vaccine clinic has gone to 2 farms one farm and 1 restaurant to vaccinate some migrant workers. And we're going again on Thursday to another farm to vaccinate more migrant workers. So hopefully we're going to spread some more positivity in that community group that we can also keep vaccinating them.
Do you think I went through Barron yesterday and I saw a lot of the foreign workers on the streets and that. Do you think there's quite a few of them in the Turtle Lake area working?
I believe so. I've been in contact with the health officer in Barron, and they have a plan for when migrant workers are coming to their county to really start vaccination. And we will be going to Cumberland next week, Wednesday, doing a tri-county vaccination clinic between Burnett, Polk, and Barron that hopefully we can spread more of this positiveness in our community to get vaccinated. And right now the farms are talking, the workers are talking to other workers. So we're having workers reach out to us to get vaccinated. So hopefully we'll start spreading the word that way.
I think that tri-county deal is kind of a key to the success of that program. Sure, thank you.
Yeah.
Any questions? Okay, Tanya, you can.
I am going to get the sheet for the Loveless Lake.
So
Do
for,
that now? Or
yeah, that's me. Yep. Loveless Lake.
Yeah, I saw that.
Land and Water, Colton and myself went to a Loveless Lake Association meeting on May 29th to talk about the toxic algae. About 30 people from the area were present. And we gave them our same presentation we gave them here, let them ask questions, just talk about solutions. So I think it was really well received that we were able to do it face to face. Since then, I did also send out a letter in the mail to all the tax owners or property tax owners around the lake discussing the toxic algae. Also, since May, we have collected 2 additional samples for the toxicity level in the water, It did not come back great. The recreation water standard set by the EPA is 8. Those water samples came back at 58 and 21, so significantly higher since the last time, as that our first 2 samples were about 6. So I will be releasing a press release hopefully today and getting this information on our website, and then also sending out an email to the Lake Association president to share with their members as well. So pretty much it's the same water quality advisory, meaning that everybody should just be cautious when they're doing recreational water activities. So make sure that you rinse off really well, don't drink a lot of water, and take care of your pets.
There's no inlet or outlet to Loveless Lake. There's no inlet or outlet to,
I believe there is an outlet out of there.
is there? Thank you, thank you.
And then, so what we're also doing is I have purchased some test strips that give us more of a real-time test knowledge or results to say that if it's above 10, that what the toxicity level is. Colton's going to take a sample this week for us. But the good news is water clarity has improved to about 12.5 feet. Permanent signs have been bought and will be posted this week. And we have also posted additional signs at bait shops throughout the county.
Any question, Bill?
Gene, when they take their water samples, you know where they're taking them? Are they going out and taking them? Are they doing them by shore? Where?
So right now, my understanding is Colton taking it right near the boat landing where people would be the typical swimming level. So not right exactly at shore, but where people would swim. And like the exact location is not really like, we're not pinpointing or GPS it, it's just about a gauge level, so more of a visual.
Have they taken any water samples in Little Loveless where the creek runs through and goes out across the road?
Not yet,
They
no.
haven't, okay.
That's a good question, Bill, because I'm just a bit, I live on Middle Pine Lake, and I'm just a bit, there's always somebody swimming or fishing right there at the boat landings. And then I drive around by Church Pine and them, same thing. Feel that's good.
Where does the water go? Where does it flow out of Loveless? Little Loveless?
Little Loveless.
And then where does it go from there?
Little Bass Lake,
Yeah.
and then into Folsom Branch, and into Wapagasset.
But you haven't seen a carrier.
Little Bass Lake was drowned with specimens as well, but that one's a little harder to see and mount. But the creek was running brown at the height of that algae bloom, but things have cleared up now. There's a little bit of a lag time with those samples, so I
These
would.
are about, the last sample we took was on the 24th. So the state lab we send them to is backed up with COVID samples, so we just have to wait patiently for those. And since then, Colton did take another sample, and we're waiting for those test results as well.
Well, we're still happy to have you in Polk County, Gene.
Thank you.
Don't be afraid to tell your people in Milwaukee you're happy here.
Oh, I tell them almost every day, so.
Well, it sounds like the test strips will be quicker.
Yeah, so we should know, like, it's like a pH paper, you stick it in the water. There's more steps to it, but you stick it in and then you let it sit, and then I'll just tell you if it's above 10 or less than 10, so we won't have that exact number, but we can at least get a gauge of where it's at.
So Tanya, are you gonna do the Wapagasset or Gene's gonna do that?
I'm gonna have Eric do that. Oh, saw it on the agenda. Last week, we didn't have much to report, so I was comfortable giving the update, but I heard that a lot has happened with the WAPL, so.
I don't have his name on here. All I have is the
Yeah.
boss lady.
Well, I am going to defer to Eric.
Go ahead, Eric. Glad to have you. Welcome to the committee.
Good morning, everyone. Again, Eric Whitecheck from Land and Water Resources Department. Yes, a lot has changed with our Wapagasset groundwater study. So we've been working on that. And in late May, we did a mailing to about 400 residents of the Wapagasset watershed.
Wow.
So we hit a lot of people with that mailing. Again, our hope was to get 100 volunteers to come in and grab a well water sample and so we could submit to the lab. We figured about 400 residents based on previous response rates, would give us the 100 samples. But in this case, we only had 52 sample bottles picked up and returned. So we got about half of our
I
goal.
would think that's pretty good though, isn't it?
It's okay. Yep. Better than 25.
Yeah.
But yeah, I think we are going to do a round two and expand our mailing list. And the end of July, we're gonna ask volunteers to come in and grab sample bottles again and.
Because you know,
another
of those 400, they are 400 residents. A lot of them would be non-residents.
Well, out of this 400, we went through the list and teased out non-residents. And the list that we have are full-time residents. They're obviously within the watershed. They have a well. They're not on municipal water or anything like that. So we winnowed down that list to very applicable candidates for well water tests. So
That was outstanding.
we're lucky that we have an expanded list. And so when we do this round two, we'll grab some of the original 400 addresses and then add another probably 200 new residents to that list and try and catch some more people to get our.
I would imagine a lot of them,
50.
probably half of the non-residents would like to participate.
It's possible, but the problem there is we're not sure if they're going to be here on the dates to pick up a bottle and take the sample and submit it. So I think originally we had over 1,000 addresses that were residents. So we have a good list.
That's a city by itself.
Just continuing on, so we had 50 samples to return to the Water and Environmental Analysis Lab in Stevens Point. We delivered those on June 9th. So they're at the lab being analyzed right now. And we're hopeful that we'll get some results here within the next 2 or 3 weeks. Have to see. Overall, I think it's gone really well. People were happy to come in and grab sample bottles, and I think everybody was successful in taking good well water samples. So
I had one call from someone who had gotten the letter.
Yeah.
And their question, the very first question was, so what if my sample comes back and it's bad, something's bad on it?
Sure.
What happens? And I said, county's gonna talk to you about this.
yeah,
Good answer.
that's an excellent question. So when we get these results back, we're going to compile all of those results into an individual mailing. And we'll have some information in that mailing about options, kind of where their tests are at, have options for them. And then there's going to be a link for a webinar or a virtual meeting that Stevens Point has offered to do. Kevin Mazarik at Stevens Point in the Wheel Lab will be live with us on a virtual meeting and answer questions and talk about options for improving their water quality, should they have problems. But hopefully this process will open the line of communication with those folks that have higher test levels and maybe water quality concerns, and we can work with them to hopefully improve that.
What kind of things are you testing for?
We are doing the homeowner package at the lab, which includes coliform bacteria, hardness, alkalinity, conductivity, pH, saturation index, nitrate, nitrogen, which is kind of the focus of this particular study, and chloride, which chloride is another test that has land management ties. So it's a pretty comprehensive test, and I think that's for the value, that was the best one have. If we were to just do coliform bacteria and nitrates, the cost of the test would have been about the same as for the homeowner package. So we're adding all those other tests for about the same price, which is $55. Good question.
Good deal for them.
It is. Yep,
Good deal.
it is. Yeah, we would have hoped that more people would have come out and we would have got a higher number than 50, but hey, we'll expand the list, receiving that mailing and hope to get 50 more. And I think we should be able to achieve that.
Eric, on the 23rd of July is Health and Human Services Steering Committee meeting in Stevens. I'll be attending that. I
Okay.
plan on lab transportation to your product is always, so if you have anything in that area, I can.
Yeah. What was the date of that again?
23rd of July.
Third? Okay.
How do you spell your name, Eric? Last name.
Wojciech. Wojchik. Right now, I learned from the lab that they'd be able to receive another 50 samples the last week of July. So that meeting might come a week before we can get our samples to the lab. Tentatively, we're hoping to get the samples to the lab on the 28th of July. So your meeting might be a little bit before that,
If I
but
can help with that at all.
I appreciate that very much. I may look into that, but as of right now,
I'll
I
be
think
in
it-
touch and actually in the July meeting before, right before that. So.
all right. Thank you for that offer. That's helpful. That's all I have.
Any other questions? Thanks for the presentation
And thank you for your support in this too, very much. Appreciate it.
Groundwater has always been kind of the #1 focus of our committee, and I hope that Ann can get some. Tanya, you have anything else along that line before we get to the big man on the agenda?
On to number 11.
Back there, chief. Come
Well, I
on,
guess that's me, huh?
you know, you know.
Well, thank you all. I always,
You've been working for Polk County.
18 and a half years.
Is that all?
Yeah. In fact, yeah, that being said, I want to take just a second to recognize my first year as being elected, Polk County's last coroner was 2003, and that was with Sheriff Raycheck. And Ann just passed away, and I just,
Today's her funeral.
and today's the funeral.
Correct.
And she was a lovely lady to work with. She did a lot of good for
Very
Polk
much.
County and our district, and
I'll have a report on the county board tonight.
good. I wanted to acknowledge her too. She was good. She was a very, very good person for me to start with.
So I first met you when you started as did you work
I
on?
worked for Dr. John.
Yeah, you worked under Dr. John. That was your start.
Right. I worked with him for probably 10 years.
So did
until he
that start
became-
around 2000?
That would have been right about 2000, no, it would have been actually about 1990. About
I
1992.
was on the board when you started.
Yeah, that'd been about 1992. That's really aging me.
I want to bring that point out, that you're older and wiser.
Oh, yeah, hopefully wiser. Well, I appreciate the opportunity to come before you and speak. Many of you I know over the years, many of you I don't, and my name is John Denny's. I'm the medical examiner for Polk County. I'm a physician assistant in my other life and work for the St. Croix Regional Medical Center. As I mentioned, I've been doing this job for 18 and a half years. It's evolved and changed dramatically since that time. It seems to be the job that nobody really wants to know anything about. Nobody cares to ever talk with the medical examiner. But I did leave the middle section of the first page does talk briefly about the outlines, the job responsibilities, legal responsibilities, as these are mandated. This is a mandated state department. In the state of Wisconsin, for those of you who don't know, in the state of Wisconsin, if your community is over 500,000, you must have a medical examiner, period. There's no ifs, ands, or buts. However, for everybody else in the state of Wisconsin, you're allowed to choose between an elected coroner or an appointed medical examiner. I was the last elected coroner in 2003. In 2005, the county board decided to switch to a medical examiner system. The advantage for the county with that move was that as a county department now, as an employee, a medical examiner appointed by the county board, they would have the county would now have the ability to set standards for education, conduct, in order to run the medical examiner's office. A coroner who's elected has no minimum requirements for anything. All you have to do is get your 200 signatures. And that was never a good option, I didn't think. And the county board went along with us many, many years ago. So since that time, I was appointed as the medical director or medical examiner in 2000, and it would have been January 2005. So a couple of things I just want to go over is going over our case numbers. 2000, when I presented I'm not sure, did I present last year? Was last year?
You did.
Did I? Okay. So previously 2019 was our record setting year. We handled 421 calls for service. Well, unfortunately, 2020, interestingly, turned out to be the exact same number of cases that we had. In 2020, we had of the deaths, 377 were classified as natural. Natural diseases are those such as cancer, heart disease, dementia, etc. We did start seeing COVID deaths in Polk County in October 2020. Correct me if I'm wrong, Tanya, because I might be a little off on this because I'm only responding to the cases that I was personally involved in the county. Had somebody had COVID and before October and transferred to regions, let's say, and died in the Twin Cities, I was never involved in that. But we actually started seeing deaths here in Polk County in October of 2020. Because of that, I mandated that all deaths associated with COVID be referred to my office for my review. And I thought it very important that I do that because I wanted to examine every single case of COVID to confirm that, yes, this is a true COVID death and it does need to be counted as a COVID death. It was very important to me that we didn't over report deaths and especially that we didn't under report deaths. They had to be accurate. There was, an awful lot of people out there who were somewhat less than believing, of all these deaths. And I had to, at least my own mind, prove that, yes, these are all COVID-related deaths. So in November of 2020, our office examined 12 deaths directly related to COVID-19. In December, we were involved in examining 19 deaths resulting in COVID-19 deaths. January, I don't have, because this is a 2020 report, but it also was a bad month. And then in February was a bad month for COVID. 2020, we had 37 deaths that we classified as accidental. An accidental death can be and is anything basically non-natural that's not suicide or homicide. An accidental death could be a car accident, motor vehicle accident, boating accident, drowning, but it also could be my grandma who falls and breaks her hip and then dies of a pulmonary embolism. That officially would be classified, depending on the time frame, that would be classified as an accidental death. And these have a lot of, these are some good statistics that have numerous implications to the family members. So it's very important that we get these right. We had 2 homicide cases, unfortunately, in Polk County, one of which was an officer-involved shooting, and the other was a dispute between brothers. In that particular case, it was an assault. The brother certainly didn't intend to kill his brother, but his actions led to the injuries that ended in the result of a death. We had 4 suicides. 3 were gunshot wounds. All were men between the ages of 34 and 44, and 1 was a suicide by an accidental or an intentional overdose, and this was a female in her 50s. I don't have on one of my other pages, I do have a list of the suicides that we've handled over the past, since I became the coroner or the medical examiner. And that's kind of for your review. We haven't, the last 3 years have been what I would consider average. Unfortunately, we always, yes.
I have a kind of a comment question. Is with COVID and mental health issues for people surrounding COVID and quarantining and all of those things, I guess that's, I don't know the right word, encouraging, not, I mean, that the suicides were that low.
Right.
It wouldn't have surprised me, I guess, had they been higher, but.
We didn't have any cases that I know of, at least, where the physician certifying the death thought sufficiently about putting COVID-19 isolation, depression, on the death certificate. I did hear a lot of talk about that, how we wish we could certify a death. If in your mind or your heart you're convinced that grandpa died because he hadn't been seeing any of his family for months and months and months, he stopped eating, he was depressed, it's all related to COVID. That's pretty hard to really analyze sufficiently to put that down. But it would be a different story if somebody truly did commit suicide and maybe they wrote a letter, said that I can't stand this any longer, I'm done dealing with it, I'm out. Then that would be a different story. We did not see any of those that I know of at all. Fire and above, the biggest call for service, what I call a call for service is when somebody needs something from the medical examiner's office. Fire and above, the biggest request comes from the mortuaries, and that has to do with cremation permits. In the state of Wisconsin, nobody can be cremated without the permission of the medical examiner. And cremations have skyrocketed over the years. As you can see, let's see if I put that in here.
On the last page.
Yeah. So the cremations, when I first started in 2003, I issued 135. Last year, I issued 342. That's a lot of cremations, and it's a significant increase. I do remember when I first took over, going through the old records from Dr. Simonstead, and I can see, I don't have them listed here, but I could see where if he had 1 or 2 in a decade, that was impressive. And then it got to be 1 or 2 a month. And then you maybe see 10 or 20 or 30 a year. And now we're up to I think the cremation rate is over 70%. In other words, of everybody who dies, 70% will end up being cremated. That's a huge increase in the last, oh my, number of, pretty much years. And many factors lead, the leading reason for this is mainly money. Average cost of a burial funeral in the United States is about 7,000 to 8,000, maybe more. When you look at a cremation, both my parents died in the last year, so I have a personal feeling or personal knowledge. You're still talking, you can do a cremation, a direct cremation, probably 2,500 to 3,500, but with a few added little things, it'll still be around $5,000. So it does become expensive, and for most families, there's various reasons, being natural, not taking up so much real estate. I mean, everybody has their own reasons, and they're all good reasons, quite honestly. I'm pleased that we're continuing our relationship with the Midwest Medical Examiner's Office in Ramsey, Minnesota. This would be in Anoka County, Minnesota. They provide Polk County with consulting forensic pathology services, as well as training when required for our deputies. So basically, if I have an autopsy that I believe needs to be done and I authorize it, it'll be the doctors at the Midwest Medical Examiner's Office that will do it. These are not cheap. These are, $2,000 each. So, I have a budgeted amount of money that I have for autopsies, and I try very hard to stick with those the best we can. Last year and the year before, we went over a little bit. This year, hopefully we're under a little bit. I think it's every 3 years, maybe, I'm pretty sure, Vince, that about every 3 years we reassess our autopsy rate. And basically what we do is we take the last 3 years, add them together, divide by 3, and we'll see. It's real complicated. And then we decide what the amount's going to be this year. So they've been real good to work with. And I've worked with them since I started in 2003. I have 2 deputy medical examiners that I work with that have been fabulous. Tony Peterson and Tiffany Steele. Tony and Tiffany are both paramedics. Tony lives and works in Frederick, and Tiffany also lives in Frederick, but she works at Regents Hospital. So the 3 of us provide full-time service for the county. It's getting a little more difficult to do that. Let's see. The medical examiner's office really became part of the community services division in Polk County a couple of years ago. This has been a very good move, as it's kind of brought to light something that I knew all along, but I never really had much to do with, and that was how much public health issues have to do with natural death, whether it be diabetes, whether it be heart disease, obesity, lack of exercise, elder abuse, what have you. These are all public health issues that end up having a direct effect on the medical examiner's office. When I can give our public health people more information about an issue, then maybe we can act on it down the road. I mean, one of the things that comes to mind, was car seats. Car seats, the new car seat mandates were actually many years ago discovered by the medical examiner over in Michigan, I believe, is what I understand, because of her research into deaths related to infants in car seats. They were able to change the configuration of the car seats and the change. And those are all good public health moves that we can sometimes contribute to. Oh, let's take a look here. I guess that's all I really have. I guess I just want to kind of bring your attention, if you would, to the calls that we've handled over the last 18 and a half years. Not necessarily just the numbers, although they're pretty impressive. Starting from 2003, 205 calls a year to 421. That's more than double. The cremation permits. They've also more than doubled. Thankfully, suicide has stayed relatively consistent with a few years intermittently that have been bad, but we've been fairly stable from that standpoint. I appreciate the honor of being your medical examiner, and I'm certainly happy to answer any questions that I can.
Dr. John is, Ann, what's her name?
Ray check? Oh, Dr. Amatuzio, she
I
retired.
can't pronounce
Yeah.
that word.
Amatuzio, she retired probably 10 years ago.
Is our contract, is that with carrying on at her office?
Yep, that's carrying off her office. When she retired, one of the things she wanted to do as she went into retirement was to make sure that her business flourished. And she was able to sell her business to the county, Anoka County, and they formed the Anoka County Medical Examiner's Office, and then eventually changed the name to the Midwest Medical Examiner's Office because they handle
That
so
was the
many
relation.
counties in Wisconsin.
Just
Minnesota.
for your new people, I remember when Dr. Ann came, there was competition for the autopsy between, we as a county board approved your budget.
Right.
And so we'd have a couple different firms came in. And if you ever wanted to see a wake-up call, I remember how she told us the importance of autopsy. And she talked that she had all the pictures of a cold case one time where there was a suicide. It was ruled a suicide of a guy who hung himself in a tree. She had done an autopsy and it was a cold case, and it came out how her office found out that it was actually a homicide. She went into the details of how she found that out. And boy, there is a lot of details to a homicide, to a autopsy. And we were hoping, I know in your budget, autopsies are the biggest cost of your
Right.
budget. And we're always hoping that the autopsies are down. There was a period there where we had a lot of people from Minnesota would come over to Wisconsin and suicide. Suicides are just about always autopsies.
Correct. Yeah, Dr. Amatuzio was a wonderful presenter. She could stand up here and keep you on the edge of your seats for an hour, much better and much more proficient than I am for sure. But she, I think she kind of helped. I can see, I mean, to this day, she helped our county board understand why an autopsy is done, the importance of it, and acknowledge that, yes, it's important and very expensive, but worth it.
It was the education that. you'll never
Terribly, yeah,
forget.
she did a very good job on that.
Was she not involved in murder in Polk County?
She handled many of ours. Yeah, she handled many of our homicides. Of course, all homicides are autopsy for medical legal purposes.
I realize that so many times a family will request an autopsy and you're the one that's got to make that decision.
That's always an uncomfortable time for me is when a loved one dies suddenly and the family right off the bat wants an autopsy. And it's my responsibility, my duty to look at the death and decide, does it require an autopsy? Always a very uncomfortable situation, but I end up having to make the decision is this in the best interest of the county? That's where I have to put my weight is the decision in the best interest of the county? Many folks, what we will do is I'll say, no, I'm sorry, I can't order an autopsy. In other words, I can't authorize an autopsy to be done and paid for by the county, but you are welcome to have your own autopsy and I can help, I can assist you in having that done.
Did we have 4 last year that we paid for?
What,
What was that stat?
oh, let's see here. I'm not sure on that one. I thought it was, guess I have to look where I put that.
Two,
I thought there was
only
two.
requested 2 complete autopsies.
So far this year in 2021.
Yeah.
Yeah, I think we had 22 that we did last year.
Really?
22, yeah.
That's
Usually
county
runs
paid
between
for?
18 and 24 is the typical amount. Yes, ma'am.
I'm just curious, how much would a private autopsy, what's the cost rate?
It'll cost a minimum of $2,000. And almost every single person or group that I know that would do a private autopsy requires cash upfront. So there's no checks, it's cash upfront. And you also have to pay a funeral home for transportation. So that's gonna be $400 or $500. So, I mean,
I think it's gonna average
expensive.
between 4 and 5.
It's expensive. Yeah, it's very expensive.
Other question, and I don't want to get too far off track here, but on a death certificate, does your office sign every death certificate in Polk County?
No, we only sign death certificates where it's our jurisdiction. In other words, if we handle the case, if we accept the case as we'll handle it, somebody who dies at home unexpectedly, even though they may be followed by one of our local providers, almost always I will sign that because the local providers don't know what happened. I mean, yeah, you've been taking care of Mrs. Johnson, let's say, for 20 years, and yes, she had high blood pressure, and yes, you've seen her the last 6 months, but you don't know what happened to her when she died. And Arnie, can you speak for that? I mean, that's kind of what we look at it. I don't want to put the doctors in that position.
It's really difficult because we have no knowledge of what happened in the last 30 days.
Right, exactly. And so that's where we also recently in the last probably 5 years, we will sign every death certificate from a hospital emergency room death. The main reason is the hospital emergency rooms up in our area nowadays are handled by doctors out of the Twin Cities. They're mainly handled by health partners, doctors who are up here for a shift, and then they won't be back for 2 weeks. The death certificate should be signed by the person's primary or who's aware of it, or the medical examiner. It shouldn't be the emergency room doctor signing anyway, and they don't like to sign the death certificate. So I end up signing the death certificates for almost all emergency room deaths.
But that's a good question because every death certificate has to be signed.
Every death certificate has to be signed, yeah. Our local docs will sign any death that's natural. And our hospitals, if somebody dies in the hospital, who's ever taking care of them in the hospital will sign that death certificate. Unless, let's say, it's a broken hip and they have their hip repaired and then they die of a blood clot the day after in the hospital. Then that would become my case and I would end up having to sign that.
Questions? Thanks, John, and
Look forward to seeing you again in 2022.
thanks for your service to Polk County.
Thank you. Yeah, I've been appreciative very much. And thank you.
Really respect your judgment. Number 12, Community Services Division Department Annual Report.
Mine's gonna be really fast. I
I
passed
know
out the
nothing
annual
about
report, and you guys can read that. Everything that we did last year is contained in this little booklet. If you have any questions, you can let me know. So I think the highlight for us was the COVID, where our response to the pandemic started in early February. And we saw our first case April 9th of 2020. From there, they trickled in and we figured out how to run our business on all levels in DCF, behavioral health, and public health as we responded to the pandemic. So you'll find that kind of embedded throughout the report. So that's what I have for the community services.
And we do not need a motion to accept your annual report. 2 events,
Okay, so.
but it's in the, you have it in the minutes of the presentation.
We turn this into the state, so, what we do with it, and we distribute to our community partners as well.
So we'll take that home and then go through it, and on next month's agenda, Madam Clerk, will be, any comments on the annual report. Is that fair?
Dr. Lawrence.
Are we looking into any way to try to encourage to get our vaccination rate higher than 40%?
So part of the outreach grant that Jean has, so we're working on ways to get people to move away from vaccine hesitancy. So we're hitting up community, where our pop-ups are in community settings like local festivities, we're at the grocery stores, and we're,
Is that what we think we're at for an average in Polk County is 40%?
yeah, 40%.
Boy, we're low.
Statewide, it's 44%, so I don't know if that's too
Yeah.
low, but it just seemed like we just.
Well, it's a long way from our goal is, I guess, what I, but you certainly want to be over 50 is your goal, correct?
They were saying 80%, but I don't know what the state is recommending now for fully vaccinated. Okay. I think Dana is up for her
He is.
annual report. So Dana is
Number
on WebEx.
13, Golden Age Manor Departmental Annual Report from
Hello, can you hear me?
Lady Dan Ross.
We can hear you, Dana.
All right. So I will just start going over some 2020 things. We do not have our completed financials yet from the auditors due to lots of, different payments and things. Last year, it's a little more complicated. So I don't have the financial piece of things for you, but I'll kind of go over some of the other census and staffing and all of that. So of course, last year was one heck of a year for a lot of people, and us included, and our world changed greatly in pretty much every aspect. So last year, our census was down, of course, related to a lot of factors with COVID. In mid-March, it was about March 13th that we closed our doors to visitors. And as everyone probably knows, that lasted for a long time. So families were opting not to bring their loved ones to the nursing homes if they could at all cost avoid that. Lots of nursing homes and COVID things in the headlines. So that definitely affected our census, as well as elective surgeries not taking place. So in 2020, our average census was 70.4. Kind of relating that to 2019, we were at about 79. So down, right about nine residents per day. The positive part of that was our Medicare A census was up from 2019. So Medicare A is what pays for those folks that come out of the hospital needing rehab, injury, illness. Medicare Part A is our highest payer. And with the pandemic, Medicare changed some of their rules. So they didn't any longer require a 3-night hospital stay because they wanted to encourage the hospitals to, if they could, to discharge those people to make more room for the COVID type things. So we were able to cover a lot more people under Medicare because of those rules. So we were at about 7.3 days or 7.3 patients per day in 2020 versus 6 in 2019. So that was up a little bit. So like I said, that is a positive thing. Kind of one other thing I looked at was admissions. So like I said, we kind of hit a standstill really in, I would say end of March, April, May. There was nothing. There was nobody out there. There was nobody wanting to come. There was nobody needing to come. So 2019, we had 116 admissions for the year. 2020, we had 104. So not, it definitely picked up at the end of the year. We kind of made up for a lot of lost ground. Now this year, we are already at 64 admissions. So kind of annualizing that, it's about 137. So we'll see if that stays on trend, but there has been a lot more activity this year. As far as some more COVID specific things for last year, we had some, there's just lots and lots of regulations that were ever changing all year long. So we were testing our staff very frequently, up to twice a week. Last year we had some staff cases here and there early on in the year. Through our first one was in June, kind of a few trickled in. And then we did have an outbreak of residents in starting October 30th, kind of lasted about a month, that we had one unit that had an outbreak. Early on in the pandemic, we had closed down our north wing, which if you've been here, it's kind of that unit before the special care unit. So we converted that completely to a COVID care unit. And it sat empty for many, many months, which was great. But we did, unfortunately, have to put that into action October 30th. I got a phone call from our lab that we had 2 positive resident cases. That of course spread from the 2 cases and affected almost one entire unit. So that was very challenging and you know, hard after all that time of not having any COVID, but we made it through that. And yeah, so just trying to think of just 2020 is hard because everything's kind of keeps going and keeps evolving from there. But any questions, I guess, so far on any of that? Or maybe more of what you want to know about it?
So you haven't got a final report from the auditors, but you anticipated you finished in the black?
Yes, and I can talk a little bit about that. So we were given many COVID provider relief payments, you know, through the CARES Act. We were given almost 800,000, or given, I don't know the right, you know, we had about $800,000 come in through those COVID provider relief payments. Lots of different payments, some smaller, some larger. So there were like technology grants to get more iPads for the residents. There were infection
of those payments, are a lot of them, you're working with Chad?
Yep. Yeah, we're working.
Your staff testing and all that, you can charge that to a COVID charge?
So the staff testing is actually covered by the state, so we're not paying anything for that. But we, you know, with a lot of these COVID provider relief payments, they're going to things like all the additional PPE that we had. I mean, the amount of PPE that we were trying to obtain and buy at crazy prices, you know, all the hand sanitizer and disinfectants, and we got some, you know, electrostatic sprayers for disinfecting. Just you know, all of that we can use this COVID funding for. Some of them, you know, most of them were like per licensed bed. There was also there's also one of the provider relief payments was based on admissions. So they were actually giving us $2,900 per admission as an incentive to take those people to get them out of the hospital. So we got one payment for that. But lots of kind of various, you know, hard to figure out, okay, what was this one for and what was that one for? So Janet and Chad and I have been working on that. So, you know, we do definitely anticipate finishing in the black, especially with the help of the funding, of that funding. So, which has been great. And we've been able to make, you know, like that COVID unit, we had to we did that right away in April, converted that unit. So we had to move all the residents that were on that unit. We bought some additional equipment, you know, things like that. You know, because, you know, more garbage cans and more linens and more, all the things that we needed to make a COVID unit safe and infection control practices in line with what we needed to do. So, and then right at the end of 2020, but if it went into 2021, our vaccination. So we were able to, there was a federal partnership through our long-term care pharmacy. So we were able to partner with our pharmacy, CVS and Omnicare. They came right to the facility and did our COVID vaccinations, which was great. It went really smooth. Our first clinic was on, I believe it was one of the last days of December, early January. So then we had them 4 weeks apart. We got the Moderna vaccine. So right now, we have about 50% of our staff that are vaccinated and over 90% of the residents. I have about 4 residents that are absolutely not getting vaccinated. Everyone else is either in the process of getting vaccinated, like new admissions. It's really great. A lot of our new admissions are coming to us vaccinated now, so they don't have to go through the 14-day quarantine period. Those residents who come to us unvaccinated, we offer them the vaccine, and we've had lots of different ways to get that to them. We're now partnering a little bit with public health. They're going to come and do some vaccines here, so that's great. Especially for those folks in our dementia unit, it's easier when the provider can come see them. So that's been good. We're not having to test our vaccinated staff anymore unless we have an outbreak. So that's saved us time and energy as well. So it's a smaller amount of people that we're testing now. Right now, we're per CMS, we're in a weekly testing pattern, hoping that we continue to drop and we'll get to that once monthly testing. But right now, we're doing it once a week. And we don't.
Right now, you're about 70% full.
Yeah, right now our census, so like last year we averaged at 70.4. Right now we're right around the 74, 75 mark, which to touch on that is a lot also due to our staffing. So staffing, as we know, with, if you've been anywhere, staffing is a struggle for folks, and we're certainly in that same boat. So, we're having to our census has to match what we can staff. So that's also held us back a little bit. Also, we have that whole entire north wing basically shut down for COVID wing. We haven't used that. We did have to use it again in January, but since the middle of January, it's been closed again, which is wonderful. But CMS, CDC, are still, we're still encouraged to have that area. And we do have a great setup. It's got an outside door. It's really nice compared to what some facilities have had to kind of work with, but that's a lot of empty space right now that we're not able to fill. So based on that, and our staffing is kind of where our census falls in there. Staffing is proving to be, like I said, a huge challenge. It has been for many years, but I think it's scarier than ever right now with the labor market, and we're not able to just close for a day to give our staff a break. Obviously we're 24/7, so we have to figure it out and keep moving forward. So yeah.
You have the new boilers and any other major facility improvements?
Yeah, the new boilers, looking at this year, we have some water heaters that need to be replaced, things like that. Nothing like the boilers, but just that continuous upgrades and improvements. We were able to do some duct cleaning, which was part of our COVID funding to clean the ducts. So that was, probably never been done. So that was nice. Things like that another thing we were able to do with some of that provider relief payment money. So yeah.
I was on the board when I think there was times when we went hundreds of thousands of dollars in reimbursement to your facility. And so on behalf of our department, we cannot thank you enough for your successful operation.
Thank you.
Good luck in 21.
Thank you.
Madam Clerk, did she have any statistics that you wanted to have in your?
If there's any reports, they can just send it to the county clerk email and then I'll save them from there.
Yeah, if there's anything you'd just be surprised how many people now. An older gentleman, I was having lunch up in Amory one day, and a guy came up to me. He said, "I'm 88 years old," and he said, I can't thank you enough for having your committee reports and your county board reports." And so I think in the last probably 10 years or so, the outlet, the way we're reaching people and their interest is mind-boggling to me, which don't take much. So thanks again.
Thank you.
No other questions for her? I guess we'll move on to our capable veteran service officer.
Morning, I'm Andy Butzler, Director of Veteran Services. So I did submit my report to the clerk's office. I'm not going to go over each item, but I want to kind of just talk about the highlights, of course, from 2020. So early on in the year, COVID-19, we had to kind of change the way we were doing things. So one of the things that led to our success, I feel, for 2020, or to be able to deliver services at the same volume, was we updated the software that we use for our electronic filing system. And that gave me the ability to essentially do my job remotely with veterans. So if a veteran, was at home, I was able to do things over the phone with them and then send them an electronic document for them to sign. Very similar to how like insurance companies are doing things, bank loans, where it's all done remotely. So for 2020, we had a busy year. Looking at 2019 and our current trend for 2019, we didn't really slow down. We didn't see any significant decline in any of the services or type of benefits that we're applying for. One of the things I want to touch on as well is that a lot of people may not be aware of is that we work with the medical examiner's office as well on occasion. For example, if we had a veteran that, died for whatever reason, if he had some service-connected conditions, we will reach out to the medical examiner's office, try to get clarification on, based on what the death certificate lists as contributing factors, we might be able to get that death certificate amended to where it's related to that service-connected condition. If we're able to achieve that, then that surviving spouse is entitled to what's called dependency indemnity compensation. So that's for a surviving spouse. And we did 11 claims for that last year. I think, to the best of my knowledge, we had five veterans pass directly to COVID-19. So 5 veterans death certificates listed COVID-19 as the cause of death. So unfortunate dealing with those families, but of course there might be benefits associated.
One question, would your office be able to assess the number of veterans in the deaths in Polk County in a year? Is there any contract of how many were veterans?
So are you asking if
Like every veteran that dies has a post, that does the veteran presentation. Do you have any a number of veterans in our county that passed away in a year?
So yes, we do. I don't have that information.
No,
with
but
me.
I mean, that's interesting.
Kind of how it works essentially is that if a veteran or their family works with a funeral home, that funeral home notifies the Wisconsin Honors Program for those military honors. And then what they do from there is they contact whichever service organization, whether it's the Amory American Legion Post or the United VFW, and then those groups go out to whichever cemeteries they cover and provide those honors.
That's interesting. Thank you.
But in return, yes, we're notified when a veteran passes.
Yeah.
Now, if a veteran goes to a cremation society, so also talking about what the medical examiner spoke briefly on is cremations. So I see that as well. When dealing with burial benefits, I would say in my department, we have close to 90% of families that have done cremation versus the traditional funeral. And cremation societies are used as well because they're even cheaper than locally. So Minneapolis or Twin Cities Cremation Society, I think there's one up in Duluth. They're a lot cheaper to use, but they don't do anything. Essentially, what I understand is they do the cremation and give it back to the family. And that's the extent of it. So Locally, there's more services provided when a cremation is done. One of the things that I've never reported on, and I don't know if it's been reported on in the past, but one of the things that I started doing is tracking retro payments or back pay for veterans. So say, for example, if we apply for a benefit, on that day that we submit the application to the VA, that becomes the effective date. Now, say, for example, if the claim takes a year or 2 years for the VA to make a decision on it, that veteran or surviving spouse is entitled for a back payment or a retro payment from the date of application to current, essentially to get them caught up. So I went back through, and for calendar year 2020, Polk County veterans received $724,000 in retro or back payments. So that's money that goes directly back to our economy. And that's just the retro payment. They're then entitled to a monthly benefit moving forward. So as far as VA benefits, it puts a lot of money back into our economy. So I just wanted to share that statistic with you. Specifically for disability compensation, it was over $677,000 in retro payments. I had one retro payment, a veteran, I think it was $124,000, a couple more at $60,000, $80,000. So those claims were an appeal for probably up to 3-4 years, and finally we were able to get the VA to grant those claims. So kind of thing. Transportation, I don't know if you plan on touching on that at all, but transportation program is up and running with the Aging and Disability Resource Center. So again, veterans can use their program for transportation to VA medical appointments. That's about it. Does anybody have any questions for me at all?
Andrew, is that the statistic that you have for Wisconsin identifier, is that driver's license or military ID?
So that would be the Wisconsin driver's license. If a veteran is eligible for, or if they think they're eligible for the Wisconsin driver's license identifier, they're able to come in and meet with me, and I can verify their service, fill out a form for them to take to the DMV to get veteran placed on their identification card. A lot of veterans, they'll take their discharge directly to the DMV and try to get it, but they're not able to do it because DMV staff are not trained in verifying that a discharge is first, in fact, true, and then second, that they meet the eligibility requirements. So that's what that is.
Thank you.
Any questions for Mr.? Once again, Madam Clerk, I hope in your report there that you can pick out some kind of statistics that in his annual report that you can have, so the people that read our committee report can have something that they can find of interest in there, because they're searching for that. And the other benefit, I think, of that, I think, is if there's any program that in our county, it's getting to know the families of veterans that, hey, they can come to you for just about anything, transportation or your, some medical or even some death assistance. Because
Yeah,
the veterans are a part of all of us.
they are, and we get a lot of questions for not only veteran benefits. So if there's something, and we have a lot of veterans that lean on us for referrals to other agencies or resources. So it's not uncommon for us to have questions that's outside of our wheelhouse, but then we refer them to the appropriate contact.
That's really the key, is outside of your wheelhouse. I mean, just some of the people I talk to, oh, I didn't know that, you know. People don't know the advantage of how our county assists veterans.
Absolutely.
Part of our freedom that we owe everything to.
And then one more thing I almost forgot. So in 2020, again, Wisconsin is trying to pass into law the Wisconsin Veterans Property Tax Credit Program. They're trying to make changes to that. Currently, you have to be 100% service-connected disabled veteran or a surviving spouse and recipient of dependency indemnity compensation in order to be eligible for the property tax credit program. I know Wisconsin has tried reducing the eligibility.
Yeah. That is huge. It shouldn't be 100%. It should be
Minnesota's 70,
anybody that needs it.
Florida's 50% starting. So hopefully they can get it to go through this time because that's a huge benefit. And again, that's money that is directly put back into our local economy.
Another good point. Well, thanks again. Thanks for your service to our,
Thank you.
it's huge. We are to number 15. Tanya and Tanya, did everybody get this full copy of the main minutes and then all this information?
They get emailed and
I
mailed.
was going through it and something that I didn't know about it, I was surprised. This attachment A, it says, please attend 2019 to 23 local development coordinated service of public transportation. There was a meeting May 10th, and right here in the government center, and yeah, this huge for this transportation is a huge crisis in our county. That part, can you?
So last month, we talked about transportation. We ended up wanting some history behind what's happening with transportation in the county. So I called my former partner in crime, Laura Neef, the director of the ADRC. They run a lot of transportation services out of the Aging and Disability Resource Center. So we're going to take team just to give you a little bit of history of what its transportation services looks like in the county, what has been done about it, and then we'll get some.
That's huge. That's what we want to know.
Guys, on what you want us to do with it. So, what you're reading is the 5-year aging plan that Laura's office is in charge of. In order to receive some of the grants that they do, they have to write a 5-year plan. And there's public hearings that go, and that's what you're reading.
I was looking at that in my research and I know nothing.
So that was a while ago. 2018, I think you guys did that.
2018 was the latest and greatest, yes.
Yep. So
Go
we're
ahead.
So I jump in? All
Yeah.
right, for those of you who don't know me, my name's Laura Neve. I'm the director of the ADRC. Thank you for inviting me here. I don't think I've been invited to this meeting since before we were established, when we were doing the planning. So the ADRC opened the doors in 2009, so it's been 12 years now, and we still seem like the new baby agency around here. So, but one of the things that we are responsible for is the transportation, specifically though for elderly and disabled. So we do have a contract with Department of Transportation for funds that are used to establish our volunteer driver program that we have. And that is actually when we took over aging back in 2012, Polk County Aging. I'm sorry, am I supposed to be following a guide?
I don't know, let's go.
Okay.
Got a couple slides.
Tanya worked so hard to get me to do a PowerPoint. I'm like, I'll just talk because that's me. So,
It's not long enough.
there you go.
I just clicked it.
So these, I would say these are great talking points. I will probably go on a tangent knowing myself, and then we'll come back and look and see if I hit them all.
Yeah.
Or that, does that work? All right. So thank you for the walk down memory lane as I was pulling this information from our past experiences, which were very exciting back then. So just some background information. Like I said, the ADRC opened in 2009, and we did not have the aging programs with us at that time. And then some of you may remember Carrie Flom, who was the director of aging.
While ago.
while ago, yes. So when she got a different position down in Emery, I was called in to help in the interim keep going with the aging programs. And there was a recommendation from the state to combine with the ADRC. Made sense. We followed through with that. And then in 2012, at the beginning of the year, Polk County Aging came under the ADRC. And then actually later that year, Burnett County followed suit when their director retired and they came under the ADRC. So when that happened, we did take on the transportation programs, which includes the volunteer program. And at the time, there was a nonprofit corporation, Polk County Transportation Corporation, that had maintained some buses and vans that were used. It was not actually under the county aging, but the program was managed by county aging. And when it was established, it made sense because the Department of Transportation grants, originally the county could not apply and get those funds. So they had to have this nonprofit be created and apply and get those funds. However, when it came under the ADRC, it was quickly determined that that is no longer needed, as the county can do it directly, and it was really losing money quickly, that corporation was. So at that time, it was decided to dissolution, that's the right word, the corporation. By the end of the year, it was dissolved and the buses were sold off, put out for bid, and the money came back. Well, one was given to Golden Age Manor because they qualified, and the rest we got money for, and it was put in the county's trust account that I established that year as well. Then one of my smartest roles with getting aging on was to steal Tanya from Barron County. So I got her set up as a supervisor, and part of that was managing the transportation programs at that time. So that would have been 2012, 2013. And 2013 was actually the first 5-year plan, transportation plan that we had to develop. So what that means is we pull all the stakeholders together in the community, those that are providing transportation, those that are needing transportation, and get a big picture view of what are all the resources available to us and what are some of the unmet needs in the community, and how can we use this information to improve upon the services. Well, that year, we happened to actually establish a very active transportation communication committee or coordination committee. And they got the goals that were established in that 5-year plan and ran with it. And that committee isn't really an ADRC committee, it's a community committee. So the ADRC is just one player of a bunch of entities that are working together for transportation improvements here. However, the ADRC does hold the documentation for that as we maintain the contract with the Department of Transportation. So when that very active group got together and we had goals as identified as needing public transportation, that's when the action started. So we had looked at, there were 2 events that were kind of going on at this time. One of them was to do a feasibility study, and Tanya had secured approval through Department of Transportation to have that done, and that they would cover 80% of the cost of it, and we just needed to get the 20% match to make it happen. So digging through jump in anytime if you need me to take a. Okay. So digging through my information, what we were able to accomplish at that time, actually, we were able, there was a little bit of a struggle to get ongoing support in the community. So with any surveys that we've ever put out as far as needs in the community, transportation is always up there, public transportation. Then when you take it a couple steps further, okay, what are people willing to do to support public transportation? And that's where the enthusiasm dies a little bit. So as an agency, we are able to use our funds for public transportation up to the population percentages of the elderly and disabled people in the community. And so we were needing to make the feasibility study happen, we had to raise $5,727, which shouldn't have been too big of a feat. But so the ADRC was able to contribute $1,088 based on those populations. And then that, of course, leaves a little over $4,500 that we had to get out in the community or other stakeholders. So Polk County itself was willing to contribute to help support the drive. And the St. Croix Chippewa Indians, they were able to contribute $100, which might sound low, but that is wonderful compared to that's the only other offer we had. And I had sent out letters to cities, to businesses, to Walmart, to many potential stakeholders to bring customers right to their door, and we didn't get any.
We got $100.
We had $100 from the tribe, and then the county was willing to, we didn't really talk about numbers, but they were willing to really contribute. But that was a very strong indication that beyond a feasibility study, what type of support would we get ongoing? I mean, that was a one-time commitment. So that was a struggle. Also at that time, we were looking at partnering, and I believe this was your brainchild with Namakagan, or was it a group? We kind of meshed together at that time.
I don't know if I want to accept full responsibility.
Dang, I was hoping you would. Okay.
No, I
So, so we had worked with Namakagan Trail, which some of you may be very familiar with. And they have public transportation routes that go out. Is it Sawyer County? Do you remember what all the counties are?
Washburn, I think they touch Barron now. Sawyer County's the heart of it though. Hayward.
We were looking at seeing how we could tie into that, because establishing public transportation is not the easiest thing to do. It's such a commitment to be able to start something, get a whole bunch of equipment, not really knowing how it's going to fly. And if it isn't a success, there you are, stuck with all this commitment and all the money that was put towards it. And we can get a lot of people in surveys that say, yes, we need it, yes, we need it. But then is it going to be used, or is it going to be set up the way that they need it to be to make it worthwhile? So we had this brainchild, which I think was a great success, the thought was. And we had worked with Namakagan Trails to utilize their equipment to do, basically establish a route that would go through our two counties, because this also included Burnett, to go through our two counties and then look at if that is a success, to eventually take that step. We would take over and maintain that as they would step out basically, and we would step in and get our equipment and start that similar program in our area. And I don't know how, it was over a year we had been working on that. So I think it started shortly after our 5-year plan was established in 2013. And then at the end of 2015 is when it was decided that it's just not going to be successful.
Yeah, I think Namacoggin, their board wanted some financial support from the counties as well. There's a lot of different combinations of grant matching that we could do with some of Laura's grants, and there's public transportation grants. We're working with them on figuring all of that out. But I think they really wanted us to have a little skin in the game and put some financial support towards putting their buses down here. And it just seemed like as we kept moving, the demands were getting more and more. So I think we just decided mutually that we needed to stop. We weren't going to be able to put any of our levy dollars into it, and we didn't have grant dollars that we could put into it at the time. So that's where it ended with our public transportation. Do you want to mention the RTAP grant that there was a study done in Burnett County previously? Yeah. So transportation's been studied and on agendas for a long time in both of the counties. So
yeah. So it was 2008. I grabbed that information. Thanks for bringing that up. I grabbed that information to bring along in case we needed any reference on it. But 2008, there was a grant that was received in Burnett County that was to do a study and then to work further into actually development of the transportation program itself. It was turned down by the Burnett County board at that time. As I read through the minutes of all of the presentations to the board, a lot of it was the commitment of financial backing. Also, there was a little bit of a political spin, negativity that went with it, as the person who had been leading it up was not communicating well with the committees and boards. So there was a little bit of a negative flavor before it ever hit into voting. So I do have all that. When this is kind of a trickle down thing, because this happened in 2009 where they voted. I reached out in 2013, which I don't know was enough time to get rid of that bad taste before deciding whether or not to support another potential outreach for transportation. So, so that was an email that I had received from the county administrator. Another issue at that time was he was brand new to the county and already hearing about some of the transportation struggles. And I feel at that time, he probably didn't really want to jump right back in when he first got started there. So it has been an ongoing issue. Both counties identify it as an ongoing issue. And I believe both counties want to work to get something established here. But like I said, it's one of those programs that it's hard to just dip your toe in and not dive in. So that's where I believe this, as I understand the conversation here, is to look at what can we do again. And I think we're getting ready. Okay.
Right. So we have, like Laura gave her kind of the scope of the ADRC. They also provide for the Veterans Service. Andy mentioned that in his report. Basically, in Polk County and Burnett County too, transportation options are limited to your Medicaid, people who are on Medicaid and medical assistance for doctor visits, the aging and the disabled, the volunteer driver program that Laura runs, and veterans. Funding is a mix of grants and state Medicaid dollars, also private pay. Other transportation, there's private companies, if you can afford to pay them, I'm sure they would let you ride on their van, disability or aged or not. So they would provide it to all people, but for the most part, I think transportation services are limited to, like I said, medical assistance, people on medical assistance, aging, disabled, or veterans. We don't have Uber here. We don't have taxi service here. If we do, it's very limited in the communities. So, and I think that's where Supervisor Pritchard was getting at when he wanted to bring the topic up for discussion last year, year before. We ended up tabling, and because of COVID, we just wouldn't have the bandwidth to be able to bring this information to you.
I will just jump in there. When it was determined not to proceed with the public transportation on the ADRC end, we did decide to proceed on a smaller scale. And just because it was just the ADRC funds, it was primarily set up for elderly and disabled. We did purchase since then 2 lift vehicles, which you would see out in the parking lot here. One is the smaller minivan with a lift, and then also a mini bus that we use. We have expanded that now for private use. So we are not able to use the ADRC funding to support the trips, but because a lift vehicle as a resource is not, it's very expensive to get lift vehicles used to be able to get that service. So we do provide that. People do have to pay the full price for the driver and that if they are not under our population of care, but it's still much cheaper than what other services are out there.
Thank you. On this slide, just Laura has hit on everything except there was another study in 2014 by a group out of Burnett County, Citizens Against Poverty. They did their own study, similar results. Probably have that too. And we can, if anybody wants copies of these studies, we can get them to you guys. We're not gonna get into, but it was just another group identifying the need and wanting to study it. So yes, 2019, 2020, we talked about it at HHS committee. We postponed because of the COVID pandemic. ADRC just completed their 3-year aging plan. You're going to talk a little bit about what you're seeing for the needs coming up.
Absolutely. So every 3 years, we have to do a comprehensive plan for our aging programs. We are in process right now, actually, and sent out many, many surveys. Thanks to the mass clinics, we hit many people coming in there.
Best results ever, probably.
It was. I couldn't believe it. You know, usually it's very hard to get people to fill out those surveys, but you know, when they're stuck sitting there for 15 minutes after getting a shot and it's handed to them, it's amazing what you can get done. So, but of course, transportation did show up in there again, and variety of needs. One of the things, you know, working with disabled people, surprisingly, we had a lot of requests for transportation to get to employment purposes too. And so, you know, that's something we will be looking at. But it was significant. I wish I brought the numbers with me, but I'd say that probably showed up within the top 10 of the unmet needs that are requested, for sure.
What was number 1?
Number 1, it is caregiving right now is very big. There's been a lot going on with dementia care. You know, that's been a focus, and there's been a lot of education going out. Now, keeping in mind that the population that these were getting to were probably, a lot of them may have already heard of our agency, and we've had some talking about community education around dementia and different caregiver topics. And so it's funny because in the surveys, what we have discovered was that there were a lot of people asking for services that are already here. So that means more outreach needs to be done. And, you know, as we all know, if you're not hearing that information when you need to hear it, it doesn't register. So, so coming out of our aging plan, we will be doing a lot of more marketing and outreach for the caregivers services, you know, along with the dementia and a lot of services that we do. Sorry.
no problem. Okay, so next steps. We know we have some transportation. We know we have transportation barriers here. So we're bringing it to this committee to tell us, what you want us to do next. We want your input. I don't know if you'll be bringing it to your committee as part of the aging plan.
Yeah, well, I guess I would like to hear what you all are thinking. And it's pretty timely because for this year's budget, actually, I had sent out a survey last year in preparation for this year's budget. We have trust funds that we maintain, and that's based on our state allocation from Department of Transportation. If we underspend our allocation, we are able to maintain that in a trust account and build that balance up for a time or to a certain level. And we are at the point where, we do need to be spending it. We had put out a survey last year, and we have spoken to veterans about the potential of buying a third lift vehicle, that we would buy that and have it designated for veterans, but then be able to use it for along with our other van program that we run. And the reason I bring that up is that, that service, we may be able, for veterans, we are providing it now, but we may be able to maintain that with the 2 vehicles we have. My concern is by taking a step in a different direction, we would love to work with you guys and look again at some public transportation. But as soon as I take a step in the other direction, those funds, wouldn't be available. And so we are able to, at this point, with the programs that we currently have established, we would be able to maintain an ongoing commitment to public transportation based on like I said, the current budgeting, looking at what our percentage for the community, for what we have here, combination for 65 and over, and then 65 and under disabled, we're looking at 32%. So if we have a public transportation put in place, technically we would be able to contribute 32% of that cost from our programs, as long as we have that maintained, available in the budget. And so before we do any other kind of expanding, which we were seriously thinking of doing this year to next year, I guess I want to hear what you guys are all thinking about, so that we don't miss an opportunity and have the money accounted for somewhere else.
Yeah.
Couple of things. On that survey that you had put out, I may have filled one of those out in the car, I don't remember. But where do people want to go? I mean, the question is, are there medical appointments? Is it shopping? Is it recreation? Where do they want to go? And then the second question would be, do they want door-to-door service or do they want pickup points?
Well, and I guess I don't know. I know Sabrina, who did those surveys, did a second round to dig deeper into, this is what you're saying. Now let's dig a little deeper with a second round of surveys. I do not know the answers to that. I don't know if those questions were asked, but the transportation that we have right now for medical is taken care of. We can do that between us and MTM for medical assistance. We're able to meet the medical needs.
But
Yeah.
there's a qualifier there for medical, is there not? If I called you and said I want to go to a medical appointment, can you come and pick me up? I might be elderly, but I'm not disabled.
Doesn't matter. We would come pick you up.
Wow, John, let's do
I did
some
not
of
know that.
that. But
Yeah, so then the program, yeah, we would pick you up door to door.
Okay.
And so that would be anyone elderly or disabled, so even younger disabled. And it's door to door service. What we do is we use our grant from Department of Transportation and we match the cost. So the volunteers get reimbursed the federal reimbursement mileage. The program covers half and then we charge out half. So that's how that works.
Good question, Bill. Thanks for that.
They have waivers too, so nobody gets denied. So if you can't afford it or you're a frequent flyer, they've got a tier of different charges. And then absolutely, if they can't afford it, they can issue a waiver.
But Tanya, for our minutes there, the ADRC, when do they meet? Where do they meet? What time? And do we have a new representative? Wasn't Joe on that? And
Yeah, so Joe was, and he's off, and now we have,
well, you'll be a very, you'll be a very active member after that. So, so we can get something in a minute, so it goes out into the media. When does the ARC meet?
so actually our next board meeting is on the 25th of this month.
Meet monthly,
We meet actually every other month. And
every other month.
Every other month, and we rotate because it is an intergovernmental agreement between Polk, Burnett, and the St. Croix Chippewa Indians. So,
Where do you meet at?
well, the next one may be at Round Lake, tribal. So the one after that, the last one we had was here. So the one, this month is tribal, then in 2 months it'll be Burnett, which you are welcome to come to any of them.
I guess I'm a little bit confused how
What time?
Day, 9:30.
our public can know when and where these meetings are, and so they have more accessibility. So this can grow.
We do post them along with like your committee meetings, so we get them to the county clerk's office and they do get posted and put on the county website. And what's that?
Burnett and Polk, and then the tribe does their own notification.
So you meet every other month, 1 month in Polk County, the next month in Burnett or at the tribal?
So 3, so Polk, Burnett, and then tribal.
Okay, now we're getting a format.
Yeah.
Are you the only representative, Sharon, or do we have 2?
I think Amy's on too. Isn't she?
I don't know.
I think she is.
Amy is, yes. And Tracy is as well. Tracy, yeah.
Tracy,
LeBlanc. Yeah.
so we have 3 representatives in the ARC.
Well, and plus some Burnett County board members.
Well, yeah, but from our county.
Yeah, yeah, and then citizen
We
members.
have 3 female reps.
Yeah, it seems like there's.
So if we do, I think it'll get done right.
what have you learned from the Namaquagan
Say, what
people?
difference does
What
that
they
make?
do, what's their outline for transportation, where they go, listings, and they can't be any more rural than we are.
They're more rural, maybe with the exception they've got strong tribal presence.
Right.
I can't remember if the tribe contribute. I know Sawyer County contributed some levy funds to make that happen. They had established routes. Like I said before, you can match your grants and you have to be really creative with how you match your grants. I think Laura got into that a little bit.
Yep.
So there's a way to do it. There is going to be some, DOT wants some skin in the game too from the counties. But I think Laura and I, our lesson learned was that we really needed to drill down on what is the need here before we build something.
Right, and I guess everybody's vision is you see a bus coming and you want to jump on it. And they have a marker in the front of the bus, we're headed to the Mall of America. I mean, that's most people have that vision. But when you get down to the nuts and bolts of it, where do people want to go and what is their purpose? So for example, if you have a van that comes and picks you up, okay, so just using this as a very elementary thing. So I want to go from Frederick to Walmart. I get picked up at 10 o'clock in the morning and the van arrives at, let's say, 10:30, give or take. They might have stops in Milltown, Centuria, wherever, Highway 8. And then they're going to return. I'm going to get back home again at 12:30. So during that time, they have to figure out what they're going to do. Is it going to take me so much time in Walmart, but that van is going to stay in one spot, or that little bus? And maybe that's the vision. I don't know that. I'm just saying that as an illustration.
Yeah, so of course, it could be structured multiple ways. Namacoggin, that's a fixed route. Wasn't that a fixed route or adjustable fixed route?
Yeah, I
So
think
you-
so.
With flexibility, based, because people called in and reserved, if I remember right.
Okay, had stops along the way.
Yeah.
So you
Okay, so that was more of a fixed route.
Mhm.
Our vans that we do now, which is for essential shopping, hopefully soon we'll get back to some more
We
social
have
trips.
2 vans and potentially 3.
Yeah, we have 2 right now, a mini bus and a van, and then we were looking at getting a 3rd.
I guess to kind of wrap things up here a little bit, I'm on this steering committee, we have 5 years Health and Human Services. We meet quarterly, and in Wednesday, July 28th, at Stevens Point, the topic is Wisconsin County Transportation Public Works. And I'm gonna have a pretty good ear and hopefully bring back some information. Because there's some very successful transportations in some other counties. I think St. Croix County is quite a ways ahead of us. You start like in Eau Claire, outside their county, and you can go all the way to the cities, to the airport, to work, to just about anything. And it looks like there's money available in different resources, but we don't have a successful format to put this together. And of all the people that I know and talk to, everybody has some need in transportation. Well, I couldn't afford to give I had to give my car up, or I can't get to work. There's multiple things. We have to satisfy that. And so I thank you for everything. It's a huge topic. Hope we can be more successful. Hope I can bring back some information. And Tanya, you'll probably be on Zoom here. But you've sat in with me on Dr. Lagas.
Could you consider doing a survey at the Polk County Fair this year? To try to drill down into
Drill down a little more on it?
more specifics when they say
Good
they want
question.
transportation.
Sure can. Yep.
And what are you willing to contribute or pay for such a service?
Yeah, and actually, we probably have our old surveys, which had a lot of them, but we can revamp that. And we have so many county tables there. I'm sure we'd be able to get a stack at multiple tables to catch different populations and, yeah. Because, I'd really want it to be more than just our population. I would rather hit, the public, general public.
Yeah, so one of the questions, go ahead.
No, go ahead, Tanya.
That is circling in my mind is, do we do more of a organic, our own survey? Or do we bring in a rural planner to do the entire county and let them analyze it and spit it back to us on what the need is?
Two things. One was going to touch on that. I take it that most of the counties that have the public transportation that John is talking about going to that meeting had some type of a plan facilitator to come in to look at those options for the county. The second thing is in surveying people in the county, what about contacting the city and village boards, township boards, and have them survey their own population, which would get you the rural population compared to people that live in St. Croix, Emery, Osceola, and in the smaller villages. They have mailings that go out all the time.
And I think rural planning would probably cover that, so they could possibly
They
reach a
don't.
bigger area.
A lot of the towns don't have staff to do that type of thing?
Sure, absolutely. But I mean, if you send a survey out, you may get, you send 200 out, hopefully you'll get 25 or 50 back just to
The
get a
town
feel.
clerk on every township can
But
do.
town of St. Croix Falls, it's time for us to revisit our comprehensive plan every 5 years. It needs to be updated. So we're in the process, and part of that is sending out a survey. And part of that is asking about transportation. So, we're actively doing that because it's a big deal. We get people asking for, I'll pay somebody to take me to the airport. I don't
Oh,
want to.
definitely. They just don't have the grassroots.
No, no. So that will be included in our survey, which I will make sure that.
I think we covered that real well.
Well, I guess maybe segueing into our next item, there is possible action, but I think maybe it could be combined with the 2020 budget priority. Do you want us to bring a recommendation back to you on what direction we do a study or how we do a study?
I would think whatever you can do on that, Tanya, would be.
Yeah.
I would think it would be helpful to hear what John has to say once that meeting is over with.
Our plan bring some things back.
Yeah, and if you can, I guess I would be interested in
And you too,
seeing.
because you'll be participating in that meeting too, the two of you.
What would it cost for a facilitator, for instance?
Yeah.
So I can tell you when we went for the feasibility study the first time, and this was through the, the Regional Planning Commission. And this was to do the full study to develop goals, gather the information, everything. That was $24,534. That was back in 2014. Along with that was an extra, I believe it was like 3,000 or so working with UW River Falls to actually get the surveys out. They were going to partner up. So, however, that being said, again, we are able to get those grants from DOT that would cover 80% of that. So, so that there is money out there that should really narrow it down to the cost of the county. We can cover about 25-30% of it, depending on the population numbers, and it's just finding that last bit. Anyways, keep me in the loop what you guys plan, because we want to be partners on that. Definitely.
I like there's good possibility. At least maybe we can study.
We'll bring that back in August. We'll bring back the transportation focus group.
And then for the next month's meeting, we'll have some things on the agenda. Yeah. I'll have the report done. Oh, no, that won't be till after. We'll have some more topics on it before I go to the.
July 28th, you said it. We'll plan on August information back. That'll give us a good month here to.
The agriculture is the 16th. I'm gonna give them all to
Gonna be
you.
driving to Stevens Point a lot.
Agriculture is July 16th.
I have
Personnel
you said it was the
finance
28th.
and county organization is the 21st. Judicial public safety is July 22nd.
28th, she said, you said.
Health and Human Services is the 23rd. Stand there that night because they're 2 days in a row.
You might have to move down there for a little while. Sounds like. So we have the 28th of July for transportation.
Appreciate the support. And in the past, the county board meetings, they limited supervisors, limited the number of meetings that we could attend. Larry Jepson had probably twice as many meetings as anybody else. And we found out that if you aren't at the table, and I'll tell you, it's been highly successful. Going to get County Road M done in transportation starting after the 4th of July. And my commitment to the county board is to get Highway 65 rebuilt. And that's working. If you aren't there, you lose, right, Vince?
That's right.
Now, if you see what I posted on the board there this morning, I just got back from the highway conferences in Wisconsin Dells, and I designed that instead of Route 66, which everybody knows, I got Route 65 Gateway to the north on the bottom. I got the attention of the Secretary of Transportation and all the government representatives. I had went to the copy shop in Oslo and had lunch with them. It was highly successful. You just got to get to these people and you get good results.
Okay, so for,
Good.
oh, somebody wants to,
Oh, just good job.
oh, thanks,
Good job.
thanks, Rita. For the clerk, we don't have any action. It's just bringing back information to the committee. And that will bring us into 2022 budget priorities. You guys all had homework, remember? For me. So did anybody think of any priorities that you want us to focus on? Station would be a good one.
Anybody have anything to add before Bill?
Doesn't it go back to the goals of what the county has put together for
Right
goals, and then goes back to what Lisa had surveyed, there were certain goals that you had from behavioral health that you put forward, same goals that come out of CJCC, so,
Lisa, you haven't had a chance to say anything. Did you want to add anything?
I don't have anything to add.
Dr. Vince? Okay, how about a motion to adjourn till July 10th, I think.
I'll make,
we just got it.
Rita, I didn't even know you were on there.
I,
I see your name on the board. Did you have anything to add to our session?
been an excellent meeting, lots of topics, and I'm excited about the transportation stuff and all the stuff you guys talked about, but thank you.
So Madam Clerk, so Joe was excused, and who else on our committee? Ann, we haven't heard from her. Amy? Amy?
She's online. I think she was on the whole. time.
Amy was online. Rita was online. We missing anybody else?
Make sure she was
Those three.
able to.
Okay, we have a motion to adjourn second, Bill? Second.
Okay.
All in favor, say aye. Motion carried, adjourned, July 13th. Excellent discussions, fantastic input from everybody. Appreciate it. Have a good week. And, county board meeting tonight.
Bye. Nice to meet you.
We have a little testimony to Ann Recheck tonight.
Yeah, her funeral's next week.
Oh, I thought I had heard it was today.
No, it's 22nd.
Oh, am I happy about that?
Yeah, so I'm planning on going to that, so because I double checked on my phone, just to be sure that I had that on the 22nd.
Well, thanks for that. I thought I missed it.
Yeah, no, it's next week.
She's a Haney girl from Balsam Lake.
Absolutely. Graduated in 1969 community.
Right?
Oh, I'm sorry,
Nice.
unless something changes.
If you go on the website, go on the Cold Stand Funeral website,
Oh,
her obituary is there.
I have to be in the cities for it, so my husband's in long-term care, so.
Yeah.
Jay Luke hired her.
Oh, I remember when she first came to work for the sheriff's department.
Really?
Oh, yeah, we go all the way back when she was an administrative secretary. Oh, I love Dan. He was a sweetheart.
She always had something to contribute.
I fished with her lots of times, so
Party
it was fun.
Just guardian.
All right.
Ellie Gilmore.
Oh, okay,
Like,
okay.
I'm
Good.
telling
You don't
you
have-
the church.
Oh, that's it. I
Thank
would.
you.
Right on.
See you.
Okay,
All right, okay, you don't-
I'll see you anymore,
No,
unless I go to bingo tomorrow night.
Oh, okay. Well, you're always welcome.
That place is always so packed.
I know.
I drive
You know,
by and the cars are lined up.
It's funny, I get there at 5 to get everybody set up.
I mean, I'm
And
familiar with
at
the
the
years.
Thursday on.
Oh,
You know what they're telling me? There are people getting there at like 3 o'clock in the afternoon, 3:30 in the afternoon, just to get a spot in the park.
Like all the time.
Yeah, it's mind boggling what you go
You're-
through.
I mean,
You're
same with-
famous. You're on the, I see you're on the board.
And it was funny, I never knew that. And Nick Stolzik
Yeah.
from
Yeah.
Lakeside
Yep.
drives by one day and I fished with him on Saturday and he looked at me and he goes, did you know that your picture was up on the board? I said, where? I said, is there numbers across it or
As
what,
soon
you
as
know?
they got that electronic board, they put that on there.
Carol put that on there. I said, I'm gonna get her.
Did she, no, she sold it, right?
Yeah,
In the
they have-
works, maybe?
Well, it's in the work. They haven't sent a closing date. Guy from Woodbury. And I've met him a couple times. He's been there.
Yeah.
But they have not set a closing date.
Because I see the for sale sign is still sitting there.
Yeah, they have to set that date before they put sold on it.
Okay.
Yeah, that's been a,
If I had to
sort
figure
of,
that out,
I don't bring that up much to her anymore.
No.
We've chatted about that at length. Well, you know, the standing joke was her daughter, well, Dennis
Private use as
Kelly,
well.
Yeah.
because
she and
it is-
Danny Pepper got married, and then they ended up buying JJ's
Yeah.
of 35, and of course, the standing joke was, how come Kelly didn't buy this place?
In the
Can't
the
afford
old system where that.
He'll
No
tell you that right
family,
off.
no family discount on that one, right?
Then he'll just tell you, I said to him, and he goes, "Oh, they can't afford it." He said, even if you chipped in, they still couldn't afford it.
Sure.
Which actually turned out good because now with COVID, of course, it just dropped and we didn't have to maintain it and go without any trips.
Yeah. Yeah.
When we used to.
That's the best, the best way. In fact,
But we have.
I had to drop grandkids off at summer school this. Mike's right across the street at.
The-
Divide
It used to
between-
be, wasn't it?
Yeah, it was. Now it's, they gave us some increase.
Oh,
For rehabilitation, whatever. But it's still good same to all of us that
Oh, yeah.
do it is good same. But I see they were just bringing in on a big truck and had everything set up, new air conditioning unit. Their air conditioning had gone up. They were bringing in smaller units to get by. And actually, my husband's was one of the warmer rooms, so they brought a unit right in his room.
Nice, like a window unit.
No, it's just on the floor, but it's the size of like a little mini fridge. Because he's got one of those in his room too. Because he likes his Diet Pepsi and he was always having to wheel himself down to where they have a fridge available for his Diet Pepsi. One day, they just brought in a brand new
Well, it's here in just.